Did you know that you've got choices? That there can be a better way? Did you know that you've got choices? Call Dr. Lerman today. 212 choices, a much better way. 212 choices. Call Dr. Lerman today. Did you know that you've got choices? That there can be a better way? Did you know that you've got choices? Call Dr. Lerman today.
Hi, my name is Dr. Gil Lerman. I'm a radiation oncologist working here at 1384 Broadway, where we treat patients with cancer. We're talking today about breast cancer. Breast cancer affects about 300,000 women every year in America. It's a serious condition. It's the most common invasive cancer in women. 40,000 women, sad to say, die of breast cancer each year in America. We're here to talk about new treatment options and innovative options that you may not hear about in other places. Later in the program, we'll be talking about a patient who went to multiple hospitals, and she found out that in multiple hospitals, even though she was getting second opinions, none of them were fresh second opinions. They were all stale second opinions. One hospital after another hospital after another hospital, super duper hospitals, all offered the same advice. And that's sad, because when a person comes for a fresh second opinion, the person usually wants a fresh second opinion. And most commonly, women with breast cancer learn about fresh second opinions here for their breast cancer. We see patients in three categories. Category number one, suspected cancer, a lump in the breast. Is it cancer or not? What to do about it? So that's issue number one. Issue number two, women with newly diagnosed breast cancer, how to best manage that breast cancer. And you'll hear today new options that most likely you will not hear elsewhere. And number three category of women who have had breast cancer and they've had either chemo or radiation or surgery or all three, and it hasn't worked, it hasn't been tolerated, or it isn't wanted. And you'll learn about options even if you've had prior treatment of chemo, radiation, or surgery, what to do about it, how we might help you. So three categories for people with suspected cancer, a lump in the breast, people with newly diagnosed breast cancer, and people with breast cancer that's been established, treated, and treatment it's not working. You're going to see many, many examples of our work today, and you'll see innovative work that most commonly you will not see elsewhere. You'll be speaking to two women, one who's had a terrible, sad story about her mother dying of breast cancer at age 42 when she was a young girl, and how it's impacted her and her family. And another patient who's had 3 breast cancer treatments on her 2 breasts, and why she came here and how our treatment is so different than the big super duper hospitals where other care is sometimes given. So my name's Dr. Lerman. It's easy to find me. It's easy to communicate with me. We're on the radio every day talking about breast cancer and other cancers. You can contact us at 212 Choices to make an appointment. You can email me, even now. Email me at gil@rsny.org. Again, my email comes to me day or night, gil@rsny.org. So there's lots of ways to communicate. If you just want a package of information and DVD, call us at 212 Choices. 212 stands for New York City. Choices because we truly believe you have choices, not just one option, but choices. Our phone number is 212 Choices. In digits, that number is 212-246-4237, 212-246-4237. And of course, if you have a medical condition, it's always best to meet in person. Just call us at that same number. We accept most insurances, Medicare, Medicaid. You can come by and pick up more information, or best is to make an appointment. My name is Dr. Lerman. I would be honored to see you if you wish. Thank you, and God bless you. My name is Dr. Gil Lerman, and I'm here with
My name is Yesenia.
And we're here talking about breast cancer. And we're making this video so that women and their families, their loved ones, can know more about breast cancer than they knew before they watched this, and what they might expect about other treatment options, in fact, all treatment options. So I know, sad to say, you lost your mother when you were a very young child.
Yes, when I was 13.
And what's your memories of that?
It was not a good time. She was diagnosed when I was 10. So it was a few years of treatment and ups and downs. So yeah, it was not a...
So when she was diagnosed, she was about 39 years old? Is that something like that?
Yes.
And at that time, was it only in the breast, or it had already traveled when it was diagnosed?
It already had.
So she had
traveled.
stage 4 cancer when
she was diagnosed, yes.
And was there any family history of breast cancer?
Yes.
So who had breast cancer in your family?
One of my aunts.
One of her sisters?
One of her sisters. And when my mom was diagnosed, all of my other aunts actually immediately went to go get mammograms, and one of them was diagnosed too.
At the same young age?
Yeah.
And so your mother probably got chemotherapy during those 3 years, pretty much?
Yes.
Did she get any radiation or surgery?
She had some surgery, but no radiation.
So she had chemo for 3 years, and then eventually the cancer traveled and she died.
Yes.
And what were your thoughts? What was going through what 10, 11-year-old girl's head about seeing her mother dying of breast cancer?
It's scary stuff. I mean, when you hear the word cancer, even as a kid, you just know it's bad and it's most likely going to be, deadly.
Did you know she was going to die when you were that young age?
I guess kind of, yeah.
So your family spoke about it?
Yeah, I mean, my mom and I spoke about it, but I wish they would have been a little bit more informed about it younger, if that makes sense.
Were you able to express your feelings and your emotions to your mother, or everything was a little hidden?
Oh, no, we talked about everything. I would go with her to the doctor, yeah.
And was she in pain during that period of time?
She was a very strong woman. I think she handled it better than most people. But it could have not been, a pleasant experience. But she handled it pretty well.
And as the years went on, so this is now almost 20 years later, how have your thoughts evolved? Have they evolved about breast cancer and what it meant to your family and the destruction of a family, like a beautiful family being so harmed?
I guess I haven't really thought about it to that point, but I feel like I should be taking care of myself more to prevent, having my family go through that again.
Well, one of the reasons to do this video is to educate, and we do a lot of education. We have radio shows and booklets and videos to educate, so that people like you can understand that, you could come here and get a breast exam, get ultrasound, get mammogram, get MRI of the breast, get special cancer markers, which might save your life.
Yeah.
And right now we have a young woman younger than you. She's about 25 years old with breast cancer, with a very advanced breast cancer. So it's not something just of old people. I mean, your mother was a young woman, and we see it in people younger even than you. So any woman can get breast cancer, and in fact, men can get breast cancer too. About 1% of breast cancer is in men, but 99% is in women, so it's predominantly in women.
Yeah.
What are your other thoughts about breast cancer? You must have had friends or neighbors or loved ones over the years. What goes through your head when you hear the word breast cancer?
I don't know. I guess it's just something that the statistics are so high. So I just kind of in mind, I'm like, oh, this probably will happen to me. How am I going to handle it?
Do you feel that way?
Yeah. And I always have since I was a teenager, basically. So now it's more about okay, I have to start getting exams and learning about all the newer, treatments for it, basically.
Well, you're welcome to come here as a patient if you want. And it might be a good idea. In fact, it's probably a good idea for every woman to come here. And that's, again, another reason why we're doing this tape. There's more than 300,000 women a year in America with breast cancer. So it's the number one cause of invasive cancer in women in America. It's number one. And so it affects more women than any other cancer, except for skin cancer, which is not really an invasive cancer. So it's the number one invasive cancer, and about 40,000 women die a year of breast cancer. And there's some misconceptions out there. Some women don't get checked because they don't want to touch their breast, or they don't want to have someone else touch their breast, or they don't want to think they're going to lose their breast. And sometimes, as you'll see in a few minutes, we have women with very advanced breast cancer, the size of an apple or an orange or a melon, that's destroyed their breast because they're so afraid of what doctors and hospitals might do. So that's another reason for this video, is to explain to people that there are options. Just because you have a lump, not all lumps are cancerous, number one. And just because you have breast cancer doesn't mean you have to lose your breast. When I came to New York to be a young doctor, at the big hospitals, 97% of women were losing their breast for breast cancer treatment, 97% of the biggest hospitals. Whereas in my practice, 90% of women kept their breast. It was exactly the opposite. The women weren't different. The cancer wasn't different. The only difference was the mentality of the doctor. So just because someone went to a big hospital and lost their breast, if your neighbor went, doesn't mean that you have to lose your breast. And different doctors present different options. And we're talking about options so that most women never have to think about losing their breast, unless they want to. And of course, ultimately, it's up to the woman to decide what she wants to do about her situation. And of course, we're fighting to educate people to do things not to have breast cancer, which is a whole other discussion.
Yeah.
What questions can you think? You're here with a cancer doctor, and you get to ask any questions you can think of about breast cancer or any other cancer. What questions can you think of?
Right now, I'm not sure. I'm a little overwhelmed. But yeah, I guess the only treatment I really have any knowledge about is just chemotherapy. So everything else, I don't know anything about all the other treatment options.
Well, that's sad, because there are many other options. And we see many women who don't want chemo. And so many people are led to believe that chemo is their only option, and it's not true. There's other methods of treatment that are incredibly successful without the toxicity of chemo. I don't know if your mother had toxicity from chemo or not, but many, many women with breast cancer have significant toxicity.
Yeah, and I know nothing about.
Okay, well, we hope you learned a lot today.
Yeah.
All right, thank you very much.
You're welcome.
Hi, this is our new breast cancer booklet, and it's available by video, as you'll be watching in the next few minutes. And also, if you call our office at 212 Choices, we'll send one out at no charge, no obligation. We won't bug you. Or you can come to our office at 1384 Broadway and pick one up. This is the cover, and it displays a woman who would be getting radiation to the breast with no cutting and no bleeding and no pain and no hospitals and no ventilators, and easy treatment, as you'll learn and speak to our patients in a few minutes. The first patient you see is a 53-year-old woman. She's married, she has a child. She came with her husband, and she had a right breast that was distorted. You can see the breast was shortened. There was asymmetry of the nipple. There was puckering of the skin, and there was a 4-centimeter mass in the superior portion of the right breast. She'd been seen elsewhere. She did not want surgery. She did not want chemotherapy. She came here for our treatment only, non-invasive treatment. And in the after picture, you can see she's in remission. The cancer is gone. There's no residual of the cancer. Her exam is fine. The pain is gone. Her breast is better. This is an example of the work that we do. This is a patient who has recurrent right breast cancer. You're looking at the chest wall of a 59-year-old woman. She was a court worker, and she had a lesion in her breast several years ago. She had lumpectomy at one of the big hospitals in New York. 1 of 15 lymph nodes were positive. She had chemotherapy. With chemo, she had a seizure. She stopped all the chemo. Then the cancer came back in the breast. So it shows you that lumpectomy alone often leads to bad results. They forgot to give her the radiation. They forgot at the biggest hospital, one of the biggest hospitals, to give her radiation. But instead, they did a mastectomy. They did mastectomy. And then you can see the cancer came back in the same site that the breast was at in the mastectomy location. She came to us with biopsy-proven recurrence in the mastectomy site. Again, proof that lumpectomy isn't working so fantastically, that mastectomy is not working so fantastically. She came to us with recurrent cancer. And then you can see on the right of the screen that she's in remission. With our treatment, the cancer went away. She's in remission. She's had testing, blood testing, physical exams. The cancer's in remission. When lumpectomy didn't work, the chemo didn't work, the mastectomy didn't work. With us, she's in remission non-invasively. This is the pictures of a 64-year-old woman. She came with her husband. She has a history of high blood pressure and diabetes and was diagnosed with this breast cancer, a left breast cancer. The mammogram was abnormal, ultrasound was abnormal. She was referred to a breast surgeon, but she did not want to have mastectomy. She had this mass growing through the skin, a large mass in the breast, eating through the skin, bleeding. On exam, she had a 6-centimeter mass with ulceration of the skin. You can see in the center pictures her PET scan showing cancer in the breast and cancer in the lymph nodes. She chose our treatment only, no surgery, no chemo. And well, you can see after our treatment, the ulceration is gone. And if you could feel the breast, you would feel the mass is gone. She's in remission. In fact, she came today very happy, in remission, the skin totally healed with our treatment only. She had declined surgery, mastectomy, lumpectomy, and chemotherapy. This is a 76-year-old woman, came with her son. Years ago, she had a left breast cancer with mastectomy, reconstruction, chemo, and standard radiation. And after all that treatment, the cancer relapsed in the reconstruction site, and she had total removal of the breast and total removal of the reconstruction, and then had 6 more months of chemotherapy. The chemo was poorly tolerated. What did she do when she had a right-sided breast cancer? Well, she wasn't going to go through the mastectomy and the chemo and the standard radiation, and she chose our treatment only. What a difference. You can see how mastectomy looks on the left chest wall, which is on your right screen, versus her breast intact with our treatment, in remission, doing well. These are images of a woman with a 4-centimeter invasive cancer who declined all chemo and surgery, chose treatment here. In the upper diagonal box is her breast cancer before our treatment. In the lower diagonal box, the cancer is gone. She's in remission, doing well with our treatment only, no surgery, no chemo. Number 6, on the opposite side of that slide. This is a picture of a man with a large mass in his right breast. The upper picture is the breast. You can see how it's distorted compared to the opposite breast. And in the lower picture, you'll see the PET scan with the large mass. That big white oval is the mass of cancer. It shows how the breast cancer picks up PET scan. He was treated here and is in remission after our treatment for breast cancer. Why do we show it? Well, number 1, it was a successful treatment. Number 2, to remind that men too can get breast cancer. About 1% of breast cancers occur in men. 99% of breast cancers occur in women. These are images of a 67-year-old woman with a 2-centimeter mass behind the nipple on the left breast. She had an inversion of the nipple. She had a palpable mass. She had a CAT scan. She had chest x-rays. She came to us not wishing to have surgery or chemotherapy. She had a biopsy that showed invasive cancer with DCIS, ductal carcinoma in situ. Pathology showed this invasive cancer, grade 2 to 3. She had a spiculated mass that was 13 millimeters, and imaging that confirming the same. On exam, she had a 2-centimeter mass by the nipple on the left breast with a palpable 1-centimeter lymph node. She had breast cancer. She had back pain. We tested her out. The cancer had traveled only to the lymph node. She chose our treatment. You can see her breasts before and after our treatment with resolution of that mass. She's happy, she's content. There was no cutting, no bleeding, no hospitals. All her work was at 1384 Broadway. This is an 86-year-old woman. She has 3 children. She came with her family. She felt a lump in the breast for the first time a year before she came to us. She was seen by oncologists. She had a PET scan. She had biopsy. She started hormonal therapy. She had a mass in the breast. On exam, she had a distorted right breast with shortening of the breast, a 7-centimeter mass in the breast, a 3-centimeter mass in the axilla. You can see from the pictures the large mass distorting the right breast in the before picture. In the after picture, just on the opposite side of the screen, you can see that mass is gone. She's doing great. She's in remission with our treatment only. No mastectomy, no lumpectomy, no chemotherapy. This is a 65-year-old woman from Jamaica. She's married with 2 children. She came with a left breast cancer. She had an invasive 4-centimeter cancer with a bloody discharge from the nipple. What are the warning signs of breast cancer? Well, it can be a lump. It can be distortion of the skin or puckering of the skin or a bloody discharge or shortening of the skin or pain. Many women come with small breast cancers and there is no palpable lesion. Many small cancers of the breast are detected only by mammogram or ultrasound or MRI. And of course, we see women with small cancers of the breast detected in that manner and treated, dependent on the patient's desire. This woman was treated for this 4-centimeter mass with a bloody discharge. Other hospitals wanted to do mastectomy and chemotherapy. Patient declined same. She was treated here with no cutting and no bleeding and no chemo and no hospitals, and she's in remission. You can see her breast is doing great, and she is very happy. This is a 69-year-old woman from New Jersey. She has 2 children. She felt a lump in the breast. Was seen by her doctor. She had mammograms and ultrasound and CAT scans. She had positive lymph nodes. She had a biopsy. She was seen by a medical oncologist who recommended chemotherapy first. She had 2 masses in the lymph nodes of her axilla, her armpit. 2 years ago, she was 165 pounds. Her weight went down when I first saw her to 134 pounds. She lost 30 pounds. So she had a markedly distorted breast. You can see it in the slide on your left. It was a 4-centimeter mass with multiple lymph nodes. She was treated for this advanced breast cancer with us only. No chemo, no surgery. And you can see on the opposite slide, she's in remission, doing very well, happy about her results. This patient is an 81-year-old woman from New York City. She came with a markedly distorted breast. She had a 9-centimeter mass. My fist is 8 centimeters. Her mass was 9 centimeters in the breast, growing through the skin, eating through the skin. You can see how it is before, and you can see how the breast is healed. The mass is shrunken also in remission after our treatment. This patient's 77 years old. She was born in Illinois. She had a right breast cancer. It was very extensive. You can see the cancer is eaten through the skin of the breast, destroyed much of the breast. You can see the cancer in the first picture. In the second picture is a CT scan showing this extensive cancer in her breast. And then the last picture showing her in remission with marked shrinkage of her cancer. Before, when she came to us, the cancer was growing through the skin. It was 11 centimeters. It was bleeding. It was malodorous. And I can tell you that she's very happy about her results. This is a woman who is 64 years old, born in Puerto Rico. She's married. She has 3 children. And, well, she had a lesion in her breast, the upper outer quadrant of the right breast, a year before she came to us. She went to 2 of the biggest hospitals in New York City. She had a biopsy showing a poorly differentiated carcinoma. She went to Tijuana. She had concoction. She spent thousands there. Nothing worked. She went back to that super pooper big hospital. They were planning to do a mastectomy for her large cancer of the breast with chemotherapy. She declined the chemo, declined the mastectomy. She went back to Mexico. She had herbs and tonics, and then finally was referred here by her physicians, and she chose our treatment. She's in remission. You can see the distortion of the breast is gone. The mass is gone. She is happy, in remission here at 1384 Broadway. This is a 78-year-old woman. She's had 3 surgeries on her left breast. All the surgeries at the biggest hospitals in New York. She had lumpectomy and no treatment. She went to another super pooper famous hospital, lumpectomy and no treatment. Then she went a 3rd time, another surgical procedure, never completed the therapy, was never referred for therapy. This teaches us a lot. Number one, it teaches us that surgery by itself often is doomed to failure. Lumpectomy, often even mastectomy, is doomed to failure. She has come here now for definitive treatment, and this is the work we do. We encourage every woman with breast cancer to consider a fresh second opinion, even if you've gone to multiple super duper hospitals. And on the opposite side, on the right side of that slide, is a picture of a 78-year-old woman who had breast cancer. She chose Dr. Lederman's treatment alone. She's in complete remission. Biopsy was negative after treatment. This is a woman who works in the Penn Station area. She did not want surgery, did not want chemotherapy. She had a left breast cancer, chose our treatment only. More than 5 years later, she's in remission. She even had a biopsy of the breast to prove that the cancer was gone after our treatment. The patient's a 57-year-old woman from Persia. She was getting mammograms through a family member. The family member was ashamed or shy to tell her that she had a mass in the breast, and she went for years with this mass growing. The mass grew to large proportions, 10 centimeters over 4 years, came to us, did not insist on no chemo, no surgery. She chose our treatment for this 10 centimeter mass. You can see the before picture on your left and after on your right. After, she recently had a biopsy of the breast showing that she is in pathologic remission, that there was no cancer remaining in the breast that could be detected. This is a woman, 68 years old, from India with diabetes and high blood pressure, and she came to us also with a massive 8 centimeter cancer, ulcerative, eating through the skin, bleeding. She chose our treatment. She also came in today. We saw her. She's in remission. The skin is totally healed. She's happy, healthy, and very pleased with the results, avoiding mastectomy, avoiding chemotherapy with our method of treatment only. This is a 70-year-old woman referred for treatment. She had biopsy-proven breast cancer. She had a history of a stroke. She was 70 years old. She came with her family. She had inflammatory breast cancer. You can see the breast was markedly enlarged before treatment. It was swollen. It was red. It was inflammatory breast cancer. Again, she was 70. She and her family did not want to go through surgery or chemo. She had our treatment. After treatment, the redness went away. The mass went away. She was in remission, and that's how she remained after our treatment. These 4 pictures are a remarkable story about a woman who came to us at age 96. And yes, we treat people who are 26 and 46 and 66 and 86 and 96 and 106. She came to us just with a swollen hand. You can see that in the first picture. She had a big swollen hand and arm. You can see the right hand, how it's swollen compared to the left hand. That's why she came. And then I examined her and I found this huge destructive breast cancer where the right breast used to be. And she had been at other facilities. And apparently doctors there never examined her or her body. She chose our treatment, even at 96, because she thought it would be feasible. She came with her family and loved ones. She liked the idea of non-invasive treatment, no chemo, no surgery at 96. And afterwards, you can see the mass is gone, the nipples reappeared, all those nodules of cancer are gone. And then in the last picture, you can see her hand. The hand that was markedly swollen in the first picture is now no longer swollen. The arm that was swollen in the first picture is no longer swollen. And the cancer of the right breast that was destroying the breast is gone. Her breast is returning, her nipple's returning. I can say that she's very happy. This patient's a 70-year-old woman. She was born in New York City. She was married. And she came to us with a self-detected left breast cancer. She had inversion of the nipple, which you can see in that picture. She had a mass there in the lateral portion of the breast. She had needle biopsies at one of the biggest hospitals in New York. It was poorly differentiated carcinoma. The ER and PR were low. The estrogen and progesterone receptors were low. And she came to us with this big distorting mass of the breast. When I examined her, there was a 7-centimeter mass in the outer portion of the left breast. There were multiple lymph nodes in her axilla. She chose our treatment only. And you can see afterwards, she's in remission, doing well, with no chemo, no surgery. This is the work that we do. This is a 48-year-old woman who was diagnosed with breast cancer 3 years before with a 2-centimeter mass. Most likely with a 2-centimeter mass, she would have a high chance of success. She went to a big hospital. They wanted to do surgery and chemotherapy and standard radiation. And she just got turned off, and she went to a concoctions doctor. And she had concoctions for 3 years, which were very costly. Every visit and ultrasound and infusion, vitamin C and other things didn't work, kept on going for 3 years. She came to us with terrible pain when a friend of hers said, hey, you might want to see Dr. Lerman. She came to us after 3 years of what she felt was extortion. She and her husband spent so much money, and the cancer was worse and worse and worse. It started from a localized cancer, and under their treatment spread and spread and spread. She came to us, and after just a few treatments, you can see the cancer shrinking in the right breast. The pain that she had was terrible, and she wrote me a note after a few treatments thanking us and thanking her staff for delivering treatment that relieved not only her pain and suffering, but shrank the cancer. This is the work that we do every day for new and recurrent cancers, most anywhere in the body. This is a 65-year-old woman who comes with a markedly distorted breast. She has a fungating mass that's ulcerative. There's a hole in the breast. This mass was immense, 12 centimeters in the right breast. There was a deep hole or ulcer through the breast. You can see in the first slide her breast before treatment, and in the second slide how her breast appeared after our treatment with no chemo, no surgery, with the profound healing. The third slide shows her breast by CT scan with the distortion of the breast, the huge mass. And the last slide shows the healing that took place with our treatment only. This is a 62-year-old woman who comes from Jamaica for evaluation of a recurrent breast cancer. She had lumpectomy in the past for invasive cancer. At that time, she declined chemo, declined radiation, and the cancer just grew. It was fungating through the skin. There was erosion of the skin and breakdown of the skin. And she came to us. I examined her. She had a 6-centimeter mass in the upper quadrant of the breast, breaking through the skin, with redness of the skin, erosion of the skin, and multiple lymph nodes. You can see on your left, the mass growing through the skin. And after our treatment, resolution, she's in remission, doing well. This is a patient with Paget's disease of the breast, a fungating mass present for years, eating through the skin of the breast. It's an unusual cancer, but we see many people with unusual, rare cancers. She had been seen by many doctors in New York City. All advised her to have mastectomy. She went for second opinions, but every doctor told her the same thing, and she just did not want to lose her breast. She came here for treatment. We talked about all the options. We staged her up. We found the cancer was confined to the local area. She declined any surgery. She declined any systemic therapy, wishing our treatment only. And you can see after our treatment for this Paget's cancer of the breast, remission. This is the work that we do every day for breast cancer at 1384 Broadway. My name is Dr. Lerman. It's always best to meet in person. If you have questions, please call us at 212 Choices. Thank you. My name is Dr. Gil Lederman, and I'm here with
Jean Perry.
Okay, so you're here and you have quite a story to tell about breast cancer.
I think so.
More than the usual woman, right? Going back many years.
Correct.
Right?
Yeah.
And many years ago, you had a cancer of the left breast.
Correct.
And you went to a usual hospital and you had the usual treatment. You had surgery and you had radiation
Yes.
for that cancer.
Correct.
Right?
Yes.
And that went pretty well for a while, right?
Yes.
And then you developed a cancer on the right breast.
Quite a few years later. Yeah.
Quite a few years later. And now you'd already had experience in another hospital with surgery, and they tried to give you chemo, and you didn't want that, and they gave you hormones, I think, for a year and a half or something like that.
They wanted me to take it for 5 years.
I understand that.
Yes.
And then you had the radiation there. But when you got your new cancer on the right breast,
Yes.
you changed your mind about the medical profession, right?
I did.
Why?
Yes. Well, first off, I was very concerned about the issue of blood in any way because I'm one of Jehovah's Witnesses. So we don't take blood transfusions. And I thought that if I had more surgery, then there might be a chance they would want me to do that. So then I didn't have that done, but I did go to cancer facilities, and they all suggested the same thing, that I needed to get cut out the surgery, and then I needed to get radiation and chemotherapy.
So every place you went to a few places.
Yes, 3.
It was almost like they were reading off of a script, the same
Exactly,
script.
exactly.
And so it makes it hard for a patient when you go to several different places and everyone's telling you the same thing without really giving you any other options.
Correct.
Right?
Yes.
And then you came here.
I did.
Why did you come here?
I happened to be half asleep one night and I heard you on the radio. I'm not a TV person, but I'm a radio person, so I listen to the radio a lot. And I heard you say that you don't need to have chemotherapy. You can get radiosurgery. So I was interested more in that. I really was. And so it seemed like it would work out for me, and it would be for my best interest.
So it wasn't just to avoid the surgery, it was really,
No,
it started out to avoid the chemo.
Yeah, I had the surgery. So 15 years later.
Well, you had the surgery before, but you didn't have
Yeah.
the surgery when the cancer came on the
right
breast.
No.
So on the right
No.
breast, when you came here,
Exactly.
you didn't want surgery,
Right.
and you didn't want chemo.
Correct.
And did any of you met with many other doctors
Did.
and many other facilities, did anyone else offer you those options?
No.
And when you came here and you heard about it, what did you think?
I thought, well, that would be great if it works.
Okay, and did you believe it would work, or you weren't sure? Or?
I did. I was really sick the first time when I had the surgery on the left breast.
The original treatment.
Yeah,
of the
and
past.
I just couldn't forget that. And
You were sick from the surgery or the chemo or from what?
No, the radiation.
You were sick from the radiation.
Yeah, because I got really burned.
So it was standard radiation.
Yes.
Okay. So you had burning and you had the surgery
and I had
then
loss
hormones.
Yes, and I had terrible loss of weight. And I tried to keep a positive attitude, and so I thought, well, I've lost a lot of weight, so maybe I can ride my pony now.
Now, I know that the people look at you, they won't believe. Can we talk about your age?
Yeah.
So what is your age today?
I'm going to be 82 in October.
82.
Yeah.
So it's incredible.
Yeah.
So you had this other cancer on the right side.
Yes.
And you came to us learning that you could, if you wish, avoid the surgery and avoid the chemo.
Exactly.
And you chose that. And so you've had radiation, you had standard radiation years ago on the left breast.
Yes.
And then you had our radiation on the right breast. And what was the difference to you?
Well, I didn't have any burning. I had nothing. It was like, actually, I couldn't believe it. I really couldn't believe that I didn't have any effect from the treatment that I had previously, the treatment that I had before, because my skin was burned and I had all this weight loss.
And you understand that when we treated you for more cancer, because at the other place,
Exactly.
you had the cancer removed. They were just giving you preventative radiation, where we were giving you radiation to try to cure the cancer. So you're getting actually a
Correct.
bigger gulp of treatment, and you had less side effects.
Right. I didn't have any.
You didn't have any side effects from our treatment?
No.
And you came here, what was a typical treatment like?
For here?
When you came here for the breast
it was
treatment?
nothing that I ever expected. I mean, I just went in under this machine, and it wasn't closed in or anything.
So it was open?
It was open.
Not claustrophobic?
Nope.
Any
Not at all.
pain?
No pain.
Any
at
cutting?
all. And no. And
Any
it was,
bleeding?
No.
Any anesthesia?
No.
Any hospitals?
No.
Any ventilators?
No.
So what was the worst experience coming here other than the traffic?
I had a very good experience being here. The staff is great. Everyone is great and very encouraging. Yeah. So
Okay, a typical treatment would last how long about?
10 minutes or so.
And
Very
after the
short.
treatment, were you sick and
No.
vomiting and nauseated?
Not at all. Not
So
at
after
all.
a treatment, what would you do after a treatment?
I would go home and garden.
You'd garden, so you're fully active.
Exactly.
You didn't have to go home and sleep for 10 hours
No.
or
No.
vomit. There was nothing like that.
No.
You were fully active. You could go to the restaurant, you could go shopping, you could go to the
Exactly.
movies, anything you want.
Exactly. Yeah.
And your tumor actually subsequently has been shown to have gone away.
Right.
Okay, now the paradoxes of your case, so you had two cancers. One side they did the lumpectomy and radiation and hormones, and you had this terrible reaction to the skin.
Right.
And you had our treatment, and there was no surgery and no chemo and no hormones, just had the treatment, and the tumor went away. And then you went back to the other doctors, right? You went to someone who told you that you made a mistake by coming here,
Right.
right? They said, oh, you made such a big mistake because you should have a treatment like you had for the first breast. Isn't that correct?
Correct.
I remember you told me that.
Exactly.
And they were making fun of our treatment,
Yes.
right?
Correct.
They were making fun of
Yes.
our treatment. And then what happened next? The cancer that they treated came back.
Came back. It came back.
The cancer they treated came back with all the surgery and the hormones and the radiation that
Right.
burnt the skin. It came back.
Yeah.
And then what did they tell you? And what did other people tell you?
Well, you probably should have had the chemotherapy in the first place.
Well, what were they going to do now that you're with the recurrent cancer after their lumpectomy and their hormones
Well,
and their radiation? What
because-
did they want to do to you?
Well, they thought that I should just take your breasts off. Then you won't have to worry about it.
Do a mastectomy. You don't have to worry about it.
I'm like,
So what do you think about it when a surgeon tells you just take your breasts off so you don't have to worry about it? What do you think about that?
The first thing I thought of was when I heard you on the radio, so many women came here, and they had the people that you saw they didn't have to have their breasts removed at all.
Right.
And so many were having their breasts removed.
Elsewhere, 97% of the big
Exactly.
hospitals were losing their breasts
And
elsewhere.
I was at big hospitals.
And 90% of my patients were keeping their breast.
Right.
So your cancer came back after their lumpectomy and their surgery and their
Yes.
radiation and their hormones. And meanwhile, they were making fun of our treatment, which was working, and the cancer's now in remission.
Mm-hmm.
And then you decided what?
Well, I'm just going to keep going living, I think. I don't know. I hope so.
So you came here.
I'm cancer free now.
But you came back here. We
Yes,
missed
I
one
did.
step, and that is
Yeah.
that we offered retreatment of the
Exactly.
cancer that came back in the breast
Yes.
that they treated. You
Yes,
had
that's number
retreatment.
3.
Treatment number 3. A woman's only born with 2 breasts usually, but you had 3 breast treatments.
Correct.
Right?
Yes.
And so far, the 2 that have worked have been our 2.
Exactly.
And so you've had a lot of time to reflect on this. What does it all mean to you?
It means that I was very fortunate to find Dr. Lederman, really. Very fortunate, and I speak very highly of this place. In fact, my son had a problem with prostate, and his surgeon told him
What kind of problem did he have?
prostate cancer.
Prostate cancer. Because people
And so-
that are listening don't know about your son.
Oh, yes. And so he had said that he was diagnosed with having prostate cancer, and that they wanted to do surgery. And I said, oh, please don't do that. You have to come and see my doctor in New York.
And he doesn't live so close,
No,
right?
he lives in Georgia.
He lives by Atlanta, Georgia, and it's a big trip.
Right.
And he came here because
he wanted to see how it would be and it would work, if it would work for him.
And he came here?
Yes, he did. He made an appointment with you.
And how was that?
Worked out just fine. He's very happy today.
Because?
He has all of his sexual activity and everything else that he has.
Has everything
before.
except one thing. The PSA, the cancer marker,
dropped down.
Is in remission.
Yeah, exactly. So he's very happy.
So what would you tell a woman with breast cancer, with a lump in the breast or cancer, or she's gone to the 5 biggest hospitals in the world, everyone tells her to do that. What would you tell that woman?
Please don't. Please don't. And I've seen other people that don't have necessarily breast cancer, but have other cancers, and they just seem to want to go to the thing that's acceptable today. So I try to talk them out of that. I really do. So, I mean, I see anybody suffering. And so I remember what you said. I went to school to help people.
It's true.
Yeah. And so I said, well, that's what most doctors are supposed to do. Do no harm. So, I feel very fortunate that I was able to come here, and my sons also. Yes.
Okay. Any regrets?
None at all. None at all.
Well, as we say, you should live to be 120 in good health.
Yes,
and you look like you're 42. And people that see you can't believe that you're 82. And I know that we didn't take any part of that, but we're just trying to keep your body together and keep your health together and keep your spirits in a good way.
Right. I appreciate everything that you've done for me and all the staff here. Really, it's been fantastic.
Thank you so much.
Thank you.
All right, God bless you.
Thank you.
Today we've spent a few minutes together learning about breast cancer, learning about new technology, speaking to several women about technology and breast cancer and the impact it's had on them and their family and what they've done about it. And you too may have a cancer, or you may be just an interested party who wants the best care for your family, your loved ones, your friends, your neighbors, or the person down the street. And we hope you've learned a lot from this information. We hope you pass it along. When someone talks about having cancer, breast cancer, or other cancers, you might want to just pat them on the shoulder and say, hey, you may want to see Dr. Lerman. Call him at 212-CHOICES. 212-CHOICES. We accept most insurances, Medicare, Medicaid. We're located at 1384 Broadway and 38th Street in the heart of New York City. It's easy to get to us. The subways that come to us include the 1, 2, 3, 4, 5, 6, ACE, NQR, B, D, FM, 7, S, and Q. Also, all the trains that go to Penn Station, which is just a few blocks away. Amtrak, Long Island Railroad, New Jersey Transit, and PATH. Also, Metro North goes to Grand Central, a few blocks away. And all the buses that come into New York City go to Port Authority. So it's easy to get to us. It's easy to communicate. You can call, you can email, you can come in, you can make an appointment. We accept most insurances, Medicare, Medicaid. We'd be honored to help care for you and your loved ones if you wish. Thank you, and God bless you.
Did you know that you've got choices? That there can be a better way? Did you know that you've got choices? Call Dr. Lerman today. 212 choices, a much better way. 212 choices. Call Dr. Lerman today. Did you know that you've got choices? That there can be a better way? Did you know that you've got choices? Call Dr. Lerman today.